Hi guys, this is Charles. I'm one of the surgeons at Southpaws. One question that I get frequently is how to distinguish between pulmonary osteomas and metastases on a CT scan. And in this case, this patient is an older beagle that has an anal sac adenocarcinoma. And so we've done a CT scan to try to assess the lungs for pulmonary metastasis. We've also CT'd the abdomen looking for lymph node metastasis. So looking here, we can see specifically right there a light gray mass within the lung parenchyma. And my feeling with that one is that it is probably a metastasis rather than a pulmonary osteoma. And the reason why I say that is that its borders are not terribly distinct. I'll enlarge this a little bit more. So its borders are not really distinct. It's fairly spherical and it's quite gray. Now I think I'll be able to find you a pulmonary osteoma on this patient as well. And so I'll try to show you how we can distinguish between the two. So looking down here, we've got some other lesions in the area down there, and those are all kind of gray and more consistent with metastases. Now when we look at, let's see, I'm just trying to find one that is more consistent with a pulmonary osteoma. The characteristics of a pulmonary osteoma is that they are irregular and very bright white. So here's one that's a little bit more irregular down here. It's not quite bright enough to be a pulmonary osteoma. Looking at this one here, that is very irregular. And so that is more consistent with the pulmonary osteoma. Looking at this lesion right here, that is quite irregular in shape, so it's not spherical and more consistent with the pulmonary osteoma. Let's just see if I can find some more lesions that are more typical. So looking up here, we've got one that's very spherical and quite gray. So we'll enlarge that a little bit more. So very spherical and gray, and so that's more consistent with metastasis. And I'm just scanning through here to see if I can find some more that would be more consistent with pulmonary osteomas. There isn't one really that's totally typical. Here's one here. So that's very, very bright white, although that's fairly regular in shape. It is very bright white, and so that's more consistent with the pulmonary osteoma. And they are osteomas, which means that they have a lot of calcium in them, and so they're going to be quite bright. Now this dog, looking at the abdominal CT scan, we can see here this huge primary anal sac tumor, and then as we head cranially, we see a lymph node that's sitting right here on the pelvic floor. And then as we head farther cranially, we can see another lymph node that's here in the pelvic canal, and many more lymph nodes up here that are dorsal to the rectum and consistent with metastases. These are more lymph nodes up here that are medial iliac lymph nodes, and there are even lymph nodes that are climbing up along the lymphatic chain, which would be attached to the colon. And there are lymph nodes in the abdomen along next to the aorta and the vena cava, and even up here in the abdomen. Now, how do we distinguish those from the adrenal glands? So the adrenal glands are going to be cranial to the respective kidney. So that's an adrenal gland sitting right there. So that's cranial to the respective kidney. When I go back and look at the left one, it's cranial to that kidney as well. And the other thing that we look for is that the phrenaco-abdominal vein, which is sitting right here, passes over the top of it. So I didn't see anything in the liver in this dog that would be consistent with metastasis. So just changing the windowing here a little bit, we can see the gallbladder sitting right there. That's the common bile duct right in there. We've got a little nodule on the spleen sitting right there. That's the stomach. That's the rest of the spleen there. The right kidney, the left kidney, and then we start, let me just lighten up this scan a little bit, we start seeing the multiple metastatic lymph nodes. There. We've got the ones climbing up the blood vessels and the lymphatics going up to the colon, multiple lymph nodes down here in medial iliac, and then in the dorsal pelvic canal. So anyway, that's pretty much it. Again, to review, to distinguish between pulmonary osteomas and lymph node metastasis, pulmonary osteomas are peripheral, very bright white and irregular. Here's one that looks like a pulmonary osteoma. You see how bright that is. And then when we compare with a metastatic lesion, they're more, so looking here, they're more cylindrical and more gray rather than bright white. So anyway, that's a little review for you. And thanks a lot for watching. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications, and hopefully I'll be live streaming some surgeries tomorrow.